So this is part 2 of your integumentary or skin chapter in your anatomy book. We're picking up right where video number 1 left off. I'm on page 154. Okay. All right, so we're still talking about the structures that are in the dermis, and the next section is on our skin glands, sweat glands, oil glands. Okay, we got lots of different glands here. So our sweat glands are also called sudoriferous. I always think of it as, instead of like sudor, I think of odor. That's how I remember that the sudoriferous is our sweat glands, because they have an odor, okay, because we sweat and we stink, okay. There's 2 kinds of sudoriferous glands, eccrine and apocrine, okay, based on what it puts out and where they are. So the eccrine is much more numerous. They are small, and they're pretty much all over the body. So think of those as your regular sweat glands. They put out sweat. So we sweat in our face, we sweat in our arms, sweat in our chest. Okay. Our apocrine glands are much less numerous. They're found in our armpit and in our genital areas. Okay. And they don't put out the same kind of sweat. The fluid that they put out is a little more thick, and the book uses the word milky. Okay. So certainly not milk, okay, but it's a thicker, less clear type substance. It does say here, though, that the odor, you know, your armpit odor, is not from the secretion itself. It has to do with the secretion mixing with bacteria that's already on your skin. Now, our apocrine glands aren't really functional before puberty. So when you think of little kids, you know, they don't wear deodorant. Why? Because they don't need it. They're not really sweating from their armpit like adults do. So once we hit puberty, those glands start kicking into function, and that's when we need to start wearing our deodorant. The next one is the sebaceous glands. And the sebaceous glands put out a substance called sebum. And it is oil which keeps our hair and our skin lubricated. Now, if you have oily skin, you're like cursing your sebum and your sebaceous glands. However, we need oil in our skin. The book describes it as nature's skin cream. It's what keeps our skin soft. When we lose it, as we do when we age, we start getting wrinkles and cracks in the skin. So we really do need this oil. What we don't want is an excess of the oil, because an excess of sebum is acne. Okay, way more. They find that sebum increases ×5 in your teenage years. So you've got like 5 times as much as you need. No wonder acne is a problem. Okay. So what is the purpose of our skin? Up until now, we've been talking about the structure of the skin and the structure of all the things within the skin. So what is the whole purpose of the skin in the first place? Number 1, it's protection. Okay. It protects our skin, our body, our inside body from anything getting in. If I drop something on my skin and I have no open cuts, I have intact skin, all I can do, I can just wipe it right off. So if I have somebody's blood on me, even if it's blood that has something in it, like a germ, a virus of some kind, if it doesn't get into me, I'm still okay. Right? So it protects us. It also regulates our temperature. We talked about this in the Intro to the Body chapter that we've already done this module, where if you get cold, your body starts to shiver. If you get hot, your body will sweat. Well, that's your skin. Okay? That's the goosebumps from the erector pili muscle, and that's the sudoriferous glands with the sweat. Number 3 there, it's a sense organ. Yeah, we just talked about the touch, the light and the deep touch. Now, I only talked about 2 of those sense organs in the skin, but there's other ones in there that look for hot and cold. All right, so if it gets chilly in the room, your skin will know it. Okay. All right, it does excretion, that's the sweat, it puts it out, and then it also absorbs vitamin D from the sunshine, and vitamin D is critical. You will learn that when we get to the skeletal chapter about how vitamin D keeps rickets and osteomalacia away as a disease. Preview for next chapter. Okay, so now it's going to run through everything I just said about those purpose. Okay. All right, so what can go wrong with the skin? Well, we already talked about some of the minor ones that we don't worry terribly. I mean, nobody worries about the fact you get a freckle. We all get scratches. We all get warts or pimples and things like that, okay? So obviously those are some. All of those are examples of what's called a lesion. In coding, a lesion is anything not normal. Anything there that shouldn't be there. So even a scratch is considered a lesion. Okay. Now, you're not going to go to the doctor for that unless it's infected or something. But, you know, if it's infected, you might need to. Okay. So one of the big problems that happens to the skin are burns. Okay. They are labeled for just how deep the burn goes. And you can see here how they're talking about 4th degree burns. We're going to talk about it in the chapter, but there it is in the picture. Okay. So a 1st degree burn is minor discomfort and some reddening of the skin. 2nd degree burn is where blisters are going to show up. So we've all had a sunburn, you know, sometimes minor, sometimes major. But hopefully you've never gotten to the 3rd degree level, but some people do. So with 2nd degree, that's where your blisters and you've got severe pain. So you have a mild sunburn, it's a little discomfort, little bit red, but no blisters. 2nd degree is when the blisters show up. Okay. A 3rd degree burn is a complete destruction of the dermis and epidermis. As soon as it's happening, you have no pain at all because your body is masking it and you've destroyed the nerve endings that sense pain. But as things start processing, as you start getting medical care, at some point you're going to have intense pain. Okay. 4th degree burn is usually like a chemical burn or an electrical burn, and this burn is all the way down into the bone. Okay. This is incredibly serious, and you probably will not have a restoration of full function to that area. When you get into coding for burns, coding is based on the rule of 9s. And what that means is that we have split the body into 9% sections. So the head, the front of the head is worth 4.5%. The back of the head is 4.5%. So in total, my head completely is 9%. The arm is 4.5% on front, 4.5% on the back. So one arm is 9, the other arm is 9. The chest, because it's so large, the front of the chest is 18%, the back of the chest is another 18%. The front of the leg and the back of the leg are 9 each. You add that up, we're to 99% of the body, so they use 1% for the genital area. Okay. So when a doctor is documenting, they're going to document just how much of the body was burned. So let's say the patient got a sunburn. They were laying on their stomach, and so their entire backs of their arms, and the backs of their legs are completely burned. So that's 18 for the chest. Yeah, let's say they're wearing a swimsuit, so like you got the little butt area but let's just go with it. So 18% for the torso, 9% for the backs of 2 legs, arms, and then 9% for each leg. So that's 18 plus 9 plus 9 plus 9. 18, 27, 30, 27, 37, 47, 45%. Okay. So that's 45% of the body when you add it up like that. When we code, we have to code that it was 45% of the body. We also have to code if that was first, second, third degree burn. Now, we'll get into that when we get into the coding. Don't worry about it now, but just know that you will see this concept of the rule of nines again this module. Okay, so here's some of the different skin infections. Impetigo is a staph or a strep skin condition, typically seen in infants, young children, and you can see how sad that little baby's face looks. Tinea is a fungal infection, such as ringworm, but it's also jock itch, athlete's foot, all of those fall into that category. The next picture there is a boil. A boil is also known as a furuncle, and if you have a group of them together, it's called a carbuncle. Scabies, this one gets me. Scabies is caused by an itch mite. So this one is actually a bug. It's often transmitted through sexual contact, and then the female will actually burrow into the skin and lay their eggs, and then eventually they will hatch and have to try and burrow out of you. Have I grossed you out yet? Okay, yeah. Okay. Next one is decubitus ulcer, also known as a pressure sore. This is a common problem with people who are bedbound or wheelchair bound. And you may have heard of when people are in their bedbound where you need to keep rotating them, let them be on their back, but then you need to rotate them to the left and to the right. I know a lot of students sometimes have been CNAs in the past, and you could probably tell me how frequently they need to be rolled. It's every couple of hours, I think. You guys probably know better than I do on that one. But that was my dad in the last month of his life. He didn't get out of bed for other reasons. But they had to keep coming in and propping him up with pillows, so that what happens is that if you lay on your back, even sitting up in a hospital bed, all of your weight are on the same hip bones, okay? And that weight eventually will degrade the skin in that area, and you'll get this pressure sore. So by rotating the patient, you spread out where their weight is being applied, and hopefully you can alleviate this. Unfortunately, it happens. It's part of being in a bed, you know, for the rest of your life, okay? Hives, also known as urticaria, is a often an allergic reaction. Okay, it's usually itchy. Hopefully it's short term. I know if I take penicillin, this would be me, and it would be for a couple of hours, but it would go away. Okay. Next one is psoriasis, this picture up here, but I'm going to scroll the screen here. Psoriasis has these white plaques deposited on the skin. It is a long-term condition. So like if you have psoriasis, you have psoriasis. It's not something like hives that goes away. Now it may have flare-ups and in downturns, but it is an ongoing condition. And then we have skin cancer. Various kinds of skin cancer. Some are more serious than others. Okay. Your squamous cell carcinoma, this one, slow growing. It's the most common skin cancer. Okay. And if not treated, it will spread into other organs. So it'll go from skin cancer to, you know, having kidney cancer or something like that. Okay. Basal cell carcinoma usually happens on the face, and it's the least likely to metastasize. And because it's on the face, they're usually very easily detected because most of us see our face on a daily basis. And if something like that starts growing, you're going to notice it and have it checked out. Okay. Malignant melanoma Milano is med term for black, so it's this black one. It is the most serious form of skin cancer. Okay. Very dangerous, and it needs treated. The problem with this one is it's not usually on the face. And so you may need somebody else to tell you that it's there. Like if it's on your back, how are you going to know it's on? I mean, who sees their back? Okay. If your loved one isn't seeing it for you, who else is seeing it? So with your skin cancer, we have these A, B, C, D, E rules. And this is how you can self-evaluate. If you've got a spot that concerns you, is it cancer or is it normal? Like my mom has a mole on her chin. It's been there her whole life. It's not cancer. Why do we know this? Because of what I'm about to say. Benign moles are symmetrical, means they're round. If you were to put a line in the middle, it's the same on each side. That's what symmetrical means. If it's cancerous, they tend to be weird shaped. Number 2, benign moles tend to have a border. This is where the mole is. Okay, regular skin, mole. And it's very clear where the mole is. If they start blending into each other, that's something to be concerned about. Color. Benign moles tend to be evenly colored. The whole mole will be like the same shade, but if it's various shades, that's a concern. Diameter. By the time it's asymmetrical, questionable borders, and various colors, typically it is now bigger than 1/4 of an inch. And the last one is moles that are benign do not change. They should stay that way. They look like what they look like. If they change, that's a concern. So if you have any spots that fall into some of these concern categories, get it looked at. I had a student sitting in my class one day, and I went through this chart, and she looked at me, and she goes, I have a spot that is all of those things. And I looked at her, and I'm like, are you serious? She goes, yeah. She was a young girl. It was on her back. Her boyfriend told her it was there. She didn't even know it. And I said, you getting that checked out? And she goes, yeah, I actually have an appointment for next week. And it was skin cancer. She was 20 years old, and the doctor told her it was from tanning beds. So while she sat in my class, she then had it removed. She had allergic reactions to the anesthesia. She had a really rough time with this removal, but it got taken care of. So don't ignore them. Okay, the last kind of cancer for the skin it talks about here is Kaposi sarcoma. And the reason why I didn't talk about this one before I got into the skin cancers is because this is not the same kind of skin cancer as the others. Kaposi is a type of cancer that is associated with AIDS patients, okay, and other patients that have immune deficiencies. So most healthy people do not get this kind of cancer. So most people with Kaposi's are your AIDS patients. Okay, that is the chapter. So let me run through the top concepts. So we already talked about the serous membranes, parietal, pleura, peritoneum. Okay, so don't forget those. All right, so our epithelial tissue is cutaneous, serous, and mucus. Connective tissue does not have epithelial cells. That's your synovial membrane, fluid, bursa, as it lubricates the joints. Your epidermis, melanin is a pigment. Vitiligo, albino, macules we talked about. We talked about the dermis and the subcutaneous. We talked about hair. I did not talk about lanugo. I don't remember seeing that in. I know it's there. I must skip right over. Lanugo is baby hair. It is when the baby is inside their mama's belly, they are covered in hair. Like it's all over. It's a protective thing in the water. Most of it sloughs off before the baby's actually born. But if any of you have had a preemie baby, that baby may have had a lot of hair on the body when it was born. Okay. Some babies are born with a lot of hair on their head and then it like rubs off in a day, yeah, that was the lanugo. It wasn't real hair. Okay. Skin receptors, we talked about the Pacini and the Meissners and how it's the deep touch and the soft touch. We talked about sweat glands, which are called eccrine and apocrine, sebaceous. So I know I'm running through this quickly, but I just covered all this stuff. So what do I need to know about this? Well, we talked about how you have more eccrine than you have apocrine. We talked about how the eccrine is your regular sweat glands, but your apocrine is in your armpits and your genital area. So like you need to know all the stuff we just talked about. Okay. Sebaceous glands puts out sebum. Remember we talked about how that's the oil for your skin and your hair. Okay. We talked about the functions. So know those. We talked about the burns. So, I mean, just don't just learn that there's first, second, third degree, fourth degree. We talked about which one had the blisters. We talked about what's damaged in the third degree burn. You need to know that kind of stuff. You don't just need to know the words that's on this slide. Okay. And we talked about these diseases. We talked about a lot more. These are the ones you need to know. Impetigo, tinea, boils, carbuncles, furuncles, decubitus, ulcer, hives. With the tinea, we talked about how that is a fungal infection. We talked about how that's jock itch, ringworm, and athlete's foot. I had to remember what they all were. Okay, so there's like other things you need to know. So, okay, those are your top concepts of this chapter. So, get working on your flashcards, work on your adaptive learning, participate in your classroom Zoom sessions. Like I cannot stress that enough about getting on Zoom every morning. The students who do that regularly don't seem to have a lot of questions because they're getting them answered on a daily basis. They're not stressed with frustration. And if those are some of the things that are plaguing you, get on the Zoom session, see what they're all about.